Can we start, Balamurli sir?
Yes, ma'am. Please, ma'am.
Right. Okay. Hari Om, everyone. So, shall we start our session with prayer? I request everyone to sit comfortable, palms resting on the knees in Chin Mudra or Gnana Mudra, eyes closed, spine erect. Let us begin today's session with the prayer. Gurur Brahma, Gurur Vishnu, गुरुर्देवो महेश्वरः गुरु साक्षात् परं ब्रह्मा तस्मै श्री गुरुवे नमः अखण्डमण्डलाकारं व्याप्तं येन चराचरम् तत्पदं दर्शितं येन तस्मै श्री गुरुवे नमः ध्यानमूलं गुरुर्मूर्ति पूजामूलं गुरुर्पदम् मन्त्रमूलं गुरुर्वाक्यम् मोक्षमूलं गुरुर्कृपा मोक्षमूलं गुरुर्कृपा. Now inhale deeply and chant 3 times Om along with me. Om. All right, now gently you can open your eyes and we'll start our today's session with the introduction. First, I will start the introduction of Shivdarshan Yoga Vidyalaya. Can anyone confirm me that my slides are visible?
Yes, ma'am.
All right, thanks. So let me introduce Shivdarshan Yoga Vidyalaya. Shivdarshan Yoga Vidyalaya is a charitable trust run by senior most Swamijis of Bihar School of Yoga. Swami Gambirananda, you can see on your right side, okay, last one where you can see the arrow. Swami Gambirananda is the Acharya and Swami Vajrapani is the founder of Shivdarshan Yoga Vidyalaya, and both are direct disciples of Swami Satyananda Saraswati, who is the founder of Bihar School of Yoga. Shivdarshan Yoga Vidyalaya is recognized as a yoga therapy research institute by DSIR, which means Department of Scientific and Industrial Research, Government of India. And Shivdarshan Yoga Vidyalaya is a 30 years old ashram located in Chennai and conducting TTC courses for the last 30 years. So what are all the TTC courses? Let me introduce them, which is going to start from the 7th of January 2024. So first is TTC 1, that is Teachers Training Course 1, which include the topics like high blood pressure, diabetes, asthma, spondylitis, and along with this, all these things, yoga nidra and meditation. All right. So these courses, TTC1 will mostly on the Sunday. All the courses will be on Sundays only. Only except few Saturdays. If any holidays are coming or something like that, then only we conduct it on Saturday. Otherwise, all the courses are on Sunday. TTC1 will be Sunday morning hours from 8 a.m. to 12:30 p.m. And then TTC2 is covers the yoga therapy for menstrual disorder, thyroid, menopause, PCOD, that is polycystic ovarian disorder, then uterus prolapse. Again, it also covers yoga nidra and meditation, which is also going to start from the 7th January 2024. And this TTC2 course will be handled in the afternoon hours from 2 p.m. to 6:30 p.m. All right. And let me introduce myself. Before introducing, for any further contact, you can contact either Swamiji or Balamuli sir, whose numbers are given here. Like Swamiji's number is 98841 14533, and Balamuli sir numbers is 98403 94093. All right. And let me introduce myself Pallavi. Again, to give basic introduction about myself, basically I am an engineer. I have completed MSc Yoga as a gold medalist. Then I have cleared UGC NET YCB 3 level. Again, along with that, I have finished Krishnamacharya Yoga Mandiram tradition teachers training courses. At the same time, I have completed Vipassana training courses. So with this, there are more against Sky Yoga courses also. So this is a very short introduction about me. And now I am going to be your diabetes yoga therapy for diabetes teacher when it is coming to TTC1. So with this, we'll start our session for yoga therapy for diabetes. So yoga therapy for diabetes mellitus. So let's see first how many people are actually suffering from diabetes mellitus, or how many people are having diabetes in our day-to-day life. You can see that your parents are having diabetes. Even nowadays, you can see each one of us from the age of 20, they are in the pre-diabetic state. And why it is? Did you realize this question? Most of our people from our surrounding are having diabetes. We have never realized. Even we can also consider if we don't check our report, everyday report. So our sugar levels are also keep on increasing. For that, why yoga therapy is needed? The special attention, why only to yoga? Let's see in detail. So epidemiology of diabetes. So as per the Indian Council of Medical Research, you might have heard in COVID-19 that ICMR. So that is what Indian Council of Medical Research has done a study which has published in 2023. The prevalence of diabetes is 10.1 crores. So total population of India right now is 150 crore. Okay. So out of that, 10.1 crore is suffering with diabetes, some kind of diabetes. So you can see what is the ratio of diabetes in our India itself. And WHO has given the prevalence of 422 million people worldwide have diabetes. So diabetes is the crucial disease which is going to double in amount by 2030. Now it is 24. And it will be rapidly going to extend by 2030 just by double amount. So that much it is. And why it is important to take care of the diabetes right now? That when you see the further slides, you will understand. So, just a minute. Okay. So, metabolic non-communicable disease. Non-communicable means it is not going to transfer from me to other person or from you to other person. That is why it is called as non-communicable disease. But it is a metabolic disease. Metabolic disease, that this we will see it in detail when it comes to yoga therapy. Okay. So metabolic non-communicable disease NCD health report of India. Okay. Again, this is the published report which has done on 1,13,000 people, almost individuals, and the age group was about 20 years. This study was done on the people, almost 1 lakh people, and the age group was about 20 years. The diabetes, the prevalence of diabetes was 11.4%, and the most common is pre-diabetes. See here, the pre-diabetes is the most common, that is 15.3%, which is again increased. We think that we don't have diabetes, but silently it is happening as a pre-diabetes. That is why diabetes is not a disease that which is going to come to you in a day or in a 2 days. It will take 10 years to 15 years to realize. So pre-diabetic state is 15.3%, which has started at the age of 20 itself. All right. Then hypertension, 35.5%. Generalized obesity, 28.6%. Abdominal obesity, which is almost around 40%. And dyslipidemia. Dyslipidemia means cholesterol, bad cholesterol. So that is 81%. So you can see the overall within that 1 lakh people, how much is the all the problems. It is not like that. Nobody is there who is not suffering from all these 5 things. So that is why it is metabolic syndrome, which covers all these diabetes, pre-diabetes, hypertension, obesity, abdominal obesity, dyslipidemia. So let's see again. So treatment of diabetes according to WHO. Okay. A series of cost-effective interventions can improve patients' outcome regardless of what type of diabetes they may have. Okay. There are different types of diabetes. That also we will see it. But what type of diabetes, it does not matter. But we can give cost-effective intervention, cost-effective treatment. You don't have to spend a lot of money also. Okay. These interventions include blood glucose control through a combination of diet, physical activity, and if necessary, medication. It is not needed that you need medication. Okay. With the combination of diet, with the combination of physical activity, you can manage your blood glucose levels. You can even control a blood pressure, lipids to reduce cardiovascular risk and other complication, and regular screening for damage to the eyes, kidneys, and feet to facilitate early treatment. So this is what is WHO giving a treatment for diabetes. So let's see what is diabetes mellitus, our topic, and why yoga therapy is needed for diabetes. That also we will see it. So diabetes mellitus, a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrate and elevated levels of glucose in the blood. So this definition is given by it's just a definition by Webster dictionary. But we will not understand what is this meaning of this. So hormone insulin is impaired and abnormal metabolism of carbohydrates. Let's see what is the easier definition. Diabetes mellitus is a group of diseases. Okay, it's a group of diseases that results in too much sugar in the blood. This is very, very easy form to understand, too much sugar in the blood. Okay, so how blood is flowing, where the blood flows? Blood flows through these blood vessels. We have arteries, through that blood flows. So these blood vessels, the blood is flowing and the glucose level in these arteries, the blood vessels is more. Okay, so that is why it is we think that it is diabetes. That is very simple definition. We understand just glucose levels are high in our blood vessels, so we have diabetes. But it is beyond much more in diabetes. When you come to yoga therapy, we will discuss all the pathophysiology of this diabetes, all the organs, how it will get affected by this simple high blood glucose. Okay, and diabetes is a chronic. Chronic means what? Chronic means it's not that you are going to get diabetes within 1 or 2 years or not within 2 days. Just like fever. Fever, you get it just as if you get it, and after 2 days you will get recover. Right? But diabetes, it is not like that. For diabetes, it will take 10 to 15 years for you to become a diabetic. See, if you see the most of the people in 40s or in 35 years of age, what is that? They are having pre-diabetes or they are having diabetes. Why? Because it is coming from last 10 years. It is not that it is just coming as it is. Okay? So pre-planned diabetes, that is why it is pre-diabetes is there within us if we not look after that diabetes. So it is a chronic. Then it is a metabolic disease. Metabolic is a vast topic that we will see in when it comes to TTC1 course. Okay. So it's a metabolic disease. As of now, you just understand it's a digestion or burning of your fuel. Okay. Metabolic disease. Characterized by elevated level of blood glucose. Means increased level of blood glucose, which leads over a time to serious damage to your heart, to your blood vessels, to your eyes, to your kidneys, and to your nerves. So these are blood vessels. You can see this red vessel, red color vessels. So this, suppose if they are blood vessels, you can have damage to these blood vessels. You can have damage to heart. You can have damage to eyes, kidneys, nerves, because these blood vessels are running all over the body. Okay. So let's see now what are all the types of diabetes. Generally, we know there are three types of diabetes. First one is type 1 diabetes. Second is type 2 diabetes. And third one is gestational diabetes. Okay. So what is type 1 diabetes? If short introduction I have to give, just understand your pancreas are not producing insulin. Okay. But there are deeper aspect of type 1 diabetes again that we have to understand in very, very detailed when it comes to a therapy. Then type 2 diabetes. It is because of your lifestyle. Okay. So everyone might have heard that I am insulin resistance. What does it mean? Type 2 diabetes, it's coming because of your lifestyle, what you eat, how you are active, how much your body is in sedentary lifestyle. That depends on all these things, you are prone to type 2 diabetes. Okay. So type 2 diabetes, how it can be reversible? Very, very simple way to reverse it. So yoga therapy is a very excellent way to reverse the type 2 diabetes. And when we see the deeper aspect of full physiology, how each and every organ how type 2 diabetes manifest within our body, then you yourself can cure this type 2 diabetes through yoga therapy. Very simple. And same thing, gestational diabetes, which happens during the pregnancy. After in your second trimester, you may get test report of you are having a gestational diabetes during the pregnancy. And during pregnancy, if you are a diabetic, then it may it may leads to type 1 diabetes in a baby which is in fetus, or the baby can be a macroscopic baby. It macroscopic means it's the heavier in weight, beyond 3 kg or beyond 3.2 kg. So you have to understand that time the baby may get suffer in diabetes from the childhood itself. Okay. So these are the three types. As of now, just three types: type 1, type 2, and gestational. When it comes to yoga therapy, again, we will see in details what are all the other types of diabetes which are coming up nowadays. It is keep on coming up. All right. So type 2 diabetes, who are at the risk factor for type 2, especially for type 2 diabetes. Why we are talking about type 1 is mostly because of your genetic or your pancreas are not working from your birth itself. Okay. But type 2 is because of your own lifestyle. What first thing is family history of your diabetes. Your mother may be having, your father may be having, somebody might from your uh, genetics may have diabetes. So there are chances of you getting a diabetes. Okay. Then next is overweight or obesity. Already we have seen the prevalence of abdominal obesity or just obesity. So because of that, there are chances of diabetes, type 2 diabetes. Third one, polycystic ovarian syndrome. You have heard about this name, PCOS. Right now, in all the girls who are just at the age of 15 or at the age of 13, they are having PCOS. Okay, this is the risk for diabetes, type 2 diabetes. Even it may turn into type 1 also. So PCOS is not only just limited to your reproductive organs. PCOS is related to your blood glucose levels. That first point you have to understand. Then next is your physical inactivity. When it comes to type 2 diabetes, physical inactivity, that is sedentary lifestyle. You are not at all active. You are not doing any kind of activity, simply sitting and doing some work. Then age factor. Yes, when it comes to age factor, you may get type 2 diabetes because your blood vessels get age as our body gets age. Our organs also gets age. But still, we have a chances during age, we can, even at the age of 70 also, we can delay that process just by doing yoga therapy, because our pranic energy we can increase it even at any age. All right. So age factor also is the one factor for type 2 diabetes. Then high blood pressure. If you have high blood pressure, there are chances of getting type 2 diabetes at risk. Okay. And what are all the symptoms of diabetes? Take type 1 diabetes or type 2 diabetes. What are all the symptoms when it comes to diabetes? What will happen? You have frequent urination. The passing of the urine is very frequent. Continuously you are going. Okay. Then you have excessive thirst. You feel very, very thirsty. Okay. So when you feel very, very thirsty, you will be keep on drinking water. At the same time, you will be frequently urinating. Okay. So what is happening? All your vitamins, all your nutrients are just getting flushed out through your urination. Okay. These things again in detail we will see in yoga therapy, how it is getting flushed out and which organs are getting affected by again diabetes. And then extreme hunger. You feel more hungry. Extreme fatigue. See, you even though you feel hungry, you eat more, but still you feel extreme fatigue. You feel more tired. What could be the reason? That we have to explore in yoga therapy, the TTC1 course. Okay. Then blurred vision. Why you are getting blurred vision when it comes to diabetes? Very, very detailed we have to see blurred vision. You will get glaucoma. You might have heard about glaucoma. Okay. Then sudden weight loss. We think that people who are having diabetes, they are only obese. Okay. No. When it comes to type 1 diabetes, they may have thin body also. Okay. So these are all the symptoms when it comes to diabetes and type 1, type 2 diabetes. All right. So risk factor of diabetes. So as I said, what are all the complications you get it from the diabetes? First thing, let's start from the beginning, from the whole body. It's not a single part of your body gets left out when you have diabetes. Okay, any one part of the body or all the part of the body will get damaged because blood vessels are moving from top of the head to tip of the toe. So definitely there is a damage to any part of the body. So first thing, let's begin with the nervous system. So brain stroke, then cerebrovascular disease, that you may get complication because of diabetes. Then when it comes to eyes, diabetic retinopathy, cataract, glaucoma. Okay. Then when it's coming down, here again it is coming down to tooth also. Periodontal disease, like for tooth, mostly root canal will happen. Okay. Then it is coming to here neck. Here, it is not mentioned here. Again, it is hypothyroidism or hyperthyroidism. That also comes from diabetes. Then next is your heart problem, cardiovascular disease. This many commonly we know that heart attack will come or heart disease will come or cholesterol. This is the only thing we consider when it comes to diabetes. No, when it comes to diabetes, it start with your brain. It's continue up to your eyes, then your tooth, then your thyroid levels, then it comes to your heart. Okay, and here also in liver, when it comes to diabetes, again, nowadays, everybody are getting non-alcoholic fatty liver. Okay, non-alcoholic fatty NAFL or FD. Okay, so that also is because of your high blood glucose level. Right? Your test report might not be showing that you have high blood glucose level, but silently your body might be going through some of the problems. Silently it might be going through some of the problem which may not occur up to the age of 40 or 35. But suddenly if it comes to 35 and 40 years of age, you will see that I am having diabetes, or I am having this heart problem, I am having tooth problem, or my eyes are getting blurred vision. Why? It is because silently blood glucose level is high in your body or in your blood vessels. Then definitely diabetic nephropathy, that is kidneys. Mostly kidneys are getting affected. Then your blood vessels. When it comes to vascular disease, peripheral vascular disease means all over the body, all over the body periphery, the vessels are moving. So all the vessels will get damaged. Blood vessels will get damaged because of the high blood glucose level. Then diabetic neuropathy. Nowadays, you might have heard about Alzheimer's disease or Parkinson. It is because of your neurological, if we say that it is a neurological disorder, but it is again the silent killer. The high blood glucose level is a silent killer for the neuropathy also. Then lastly, you will see that foot damage, ampulla of the foot. These things you commonly see in your families. So you have to cut the foot or toe. Why? It is because the high blood glucose level. These things we are going to see in very detail when it comes to yoga therapy. Okay, and the all the physiology itself and how your metabolic functions are happening. This all in detail we will see in that yoga therapy course. So just know the introduction, how the blood vessel, how your high blood glucose levels are affecting your whole body. If even if it comes to PCOD, even if it comes to blood pressure, if it comes to any kind of neuropathy or nervous system damage, anything. So to simply to understand, this is healthy glucose level, insulin. The healthy pancreas is producing insulin and the cells are receiving glucose and insulin receptor. Okay. In type 1, pancreas are not producing insulin, so cells are not receiving glucose. Type 2 is again insulin is produced, but cells are not receiving glucose. This again in detail we will see it. Okay. So why? So the function, let me tell you the function of diabetes, if it comes, it is going to cellular level. It is not up to limited to your obesity or to your whole body. There are trillions of cell in your body. Okay, so that those trillions of cells are getting affected by your high blood glucose level. So it is not limited to just obesity or high cholesterol or to heart disease, cardiovascular or hypertension. Each and every cell will get damaged in high blood glucose level. Okay. So how yoga for diabetes can be helpful. So when it comes to yoga therapy for diabetes, what it covers in yoga therapy? First is diet. Okay, diet part. Okay, diet. Second one is Shatkriya. Shatkriya is again, it's a kriyas. We teach it like Shanka Prakshalana Kriya. So that will help again to cleanse your body. Okay. Then asanas, then pranayama, then yoga nidra, then dharana, dhyana as a part of meditation. Okay. So yoga does not limit it to only asanas. This first thing you have to make sure. Yoga does not mean only asana. Yoga means combination of like it says Ashtanga yoga. Okay. So like that, the Ashtanga yoga in diabetes, if it is coming, or any disease, it comes diet, your Shatkriyas, asanas, pranayama, yoga nidra, dharana, and dhyana. And what benefits you get it if it is coming to diabetes? First is physical benefit. You will have more flexibility, that your sedentary lifestyle, the inactivity goes away. Okay. Physically, you build up the strength. You will not feel fatigue when it comes to yoga, when it comes to diabetes. The fatigue you feel, that won't be there because you are building the stamina through asanas, through shatkriyas. You are cleansing your body. Through diet, you are cleansing your body. So physically, you become more active. Your cells will respond to it positively. Okay. Then next level here I have not mentioned, but pranic level. The prana within your own body will improve. It's like prana. Why the problems are coming, the diabetes or hypertension? Because the level of prana in your body is getting depleted all the time. The depletion of prana because of the depletion of prana in any organ. Take it pancreas, the depletion of prana. So your pancreas are not working. Take it heart, depletion of prana in your heart region. So your heart, you are getting heart attack. Okay? Or over emotions. Okay? So that also will congestion of prana somewhere. So that will again create the problems in your body. So when it comes to yoga therapy, it is not that only it gives physical benefit, not only flexibility or strength. It gives you mental strength. When it is going through yoga nidra, meditation, dharana, then pranayama, you will get a mental strength. Mentally, you will feel more like stability, the strength in your thinking. Your cognitive levels will improve. Your memory will not diminish when it comes to Parkinson or Alzheimer. Okay, the stability within your body will improve. Emotional levels also improve. When through yoga nidra, you can feel that your emotional level has, like, you will not feel depleted because of some emotion. You will get a strength. So emotional strength you will have. Then definitely there is a spiritual benefit at the end. When you cross over all these things, first physically, you make yourself strong, you make yourself stable. Then mentally, you will get strengthened. Emotionally, also, you will get strengthened. Cognitive function, also, your memories, your attention, everything, your awareness increases. After all these things, you will get spiritually strong. That is what the purpose of life. We don't want simply physical benefit. When it comes to our life, we should have disease free life. Even if disease is there, how you will manage it in a better way. So yoga therapy will help you. If you have diabetes, yes, we can give strength to the our client, also to student. How can you manage that yoga diabetes? Through good lifestyle changes, through yoga. So you will get, you can tell them that physical benefit, mental benefit, emotional benefit, then cognitive benefit, and at the end, spiritual benefit. Okay. So these are the yoga therapy for everything. We will see physiology, what are all the benefits of asana, which asanas we have to give for diabetes, which pranayama, what is the ratio, how yoga nidra has to be given, how meditation has to be given, what kind of diet should be taken by the diabetes people. These are all things we will see in yoga therapy for diabetes in detail. Okay, so thank you all being with me. Any question regarding this TTC? If you have, just we can go ahead. Anybody is having any question to just know about more about the diabetes simply, or to relate it to yoga?
Hari Om, ma'am.
Hari
This is
Om.
Shakuntala from Ashok Nagar, Chennai, ma'am.
Hari Om.
Ma'am, if we want to have Shatkriyas at the ashram, can we come in person? Is there any or like that, any system like that for Kriyas? Can we come over to the ashram? Because we are from Chennai.
Okay, so yeah, that volunteer number is that Balamurli sir number. So you can
Yeah.
inquire him. Okay.
Okay,
So
okay,
regarding Shatkriyas process.
okay. Thank you. Hari Om.
We will teach you how to do Shatkriyas even at home in these courses. So like you can do it at home also, when once you learn that what are all the precautions you have to take, what are all the contraindication, who should do and what way we should do Shatkriyas. All these things will be provided to you. Even at the home also you can do Shatkriyas if once after learning this.
Actually, I know the procedure, ma'am, but I don't know who can do, who should not do, and am I
Okay.
suitable for it and all. So I would
Okay,
like to have in person with the gurus for once at least.
okay. So that you can contact with Balamurli sir if you want
Okay.
any personal contact, like personal
Yeah,
therapy.
I'm student of Balmurli sir for Patanjali Yoga Sutras. I'll contact him.
You can contact him. Yes,
Thank you. Thank you.
yes, sir.
Madam,
Hari?
this is Dr. Hari Krishnan from Mambalam.
Okay, sir.
So I just want to know, I'm an Ayurvedic doctor, so I just want to know whether the yoga therapy for diabetes in patients who are lean diabetes patients without any metabolic syndrome, very high blood glucose and urine glucose.
Hmm.
So in that case, in how many days or months the result is expected, whether how yoga therapy is effective for them?
Okay. See, mostly if they don't have that, they have lean body or they don't have any metabolic syndrome. So it is, that means it is mostly type 1 diabetes. Okay. So type 1 diabetes, we can say that through meditation or through yoga nidra, their pranic energy we can increase. Okay. Definitely through asanas also, when they do stay posture, the prana in that level, that prana in the pancreas can be redirected. Okay. So at the same time, when do pranayama, the prana in that pancreas level can be redirected again.
Okay.
So type 1 diabetes, we can take them in a sustainable manner. Okay, even you can say type 1 is non-reversible because their
Yeah.
pancreas are not functioning. As you are a doctor, you know very well, sir.
Yeah.
So it's non-reversible, but we can lead the life in a sustainable manner, in a very, very healthy manner. With that itself, we can reduce the insulin level, we can reduce the injections or tablets also, the mgs we can reduce. That way we can proceed.
And thank you. And how about the diabetic neuropathy, peripheral burning sensation or numbness? We can give results.
Diabetic neuropathy means it is already diabetes is there, sir. So definitely when we do asana, okay, so first diet part and asana part, their glucose level will slowly it starts coming down. When it comes to asana and pranayama, the glucose levels will come down. When glucose levels will come down, definitely blood vessels, the damage happened to the already to the blood vessels in their eyes. Okay, already
Okay.
there is a damage happened to their blood vessels in the eye. But if they do pranayama and they do asana, then what is happening? New nerve formation starts, which is the indirect pathway. It will take time. So see, diabetes has taken time for 10 to 15 years. So definitely it will take time. But again, it is curable. The damage will not be more. The
So
further
there,
damage.
for example, some patients they say we are keeping our sugar in control. We are taking medicine regularly, but numbness alone is there in the legs and feet.
Yes,
So
that is why they need activity. They need each and every joint activity. Numbness is there. Why numbness is there? Your blood flow is not reaching up to that level, or your awareness at that level is not there. So when it comes to yoga nidra, what we are doing, each and every joint you are giving awareness. Even from the tip of this finger also we are giving awareness. Tip of the toe also we are giving awareness. So that
okay.
once that awareness develops, what will, it is not necessary that every person need asana, even though they are doing some gym activity. But there is no awareness. Simply they are doing as a physical activity. So when you do it with awareness, your awareness moves to that place. So prana flows increase to that place.
Yeah.
So that is how the yoga will improve their overall benefit. It gives overall benefit to a person.
Okay. Thank you.
Ma'am, I have a question here. This is Lakshmi Prabha from Pondicherry. How effective yoga is for diabetics of aged people, ma'am? Like if they are above 65 or 70, would it still be effective?
Yes, definitely. Why? Because see, when you are aging, definitely each and every body part are getting depletion of prana. Okay, depletion of organ level. Internally, we cannot see organ, Like we lose the strength in our body as we age. Same thing, organs also lose their strength to produce insulin, right? But when you do yoga, there is a strength and stability, which at that level also sustainability is there. Sustainability, you can improve. See, with tablet, what you are doing, you are trying to live from 65 till 85. You are increasing your lifespan from 20 years along with the tablet, along with the medication. But same thing, you can do it with yoga therapy. If you build your own strength through your cost effective way, then the same sustainability can go up to 85. It is not necessary that when you take a medication, you are definitely trying to damage other organs. Then with one tablet, it will not remain there. With other tablet, it will come. With the third tablet, it will come. It is not staying up to one tablet then. But when it comes to yoga therapy without tablet, you can sustain. And all the organs remain the same. Right?
Thank you.
Yes, Rao sir. We take a last question because next asthma is there.
Namaste, Amma. One question already she asked about this one. My wife is above 60. She is 61. Now, what we have the problem is she was in insulin, but we are going to another doctor, which are trying to come out. There is no insulin production is there, she said. So, and their combination. Those people, if they wanted to try, can they adapt this? Second thing is, I think diet also plays a very, very major role. That is what our experience. Would you be giving any indications towards that? What type of diet also required in those process? And second thing is, what are the requirements for attending the course? 3 questions.
Okay. So first question I will answer it. What are all the requirements for attending the course? There is no requirement. Okay. If you are keen interested in learning the yoga, then you can attend the yoga therapy course. Okay. First thing this. Second thing, diet part, when it comes to diabetes, definitely we will, in that syllabus itself, diet part is there, how you can manage the diet level. Not, we are not going to give you this you should eat. Because see, I can be a South Indian, I can be a North Indian, I can be a Maharashtrian. So everybody's diet is different. So, but in that, I can suggest you what kind of diet pattern you can take in your own way, in your own traditional way. Okay, that I will suggest it in that syllabus itself, right? Then the third one, as your wife is 61 years age and she's on insulin. So we can reduce that level of insulin also through simple yoga postures. At the same time, pranayama. At the same time, meditation. Okay, so when this kind of age is coming, they may have emotions also. So this meditation and yoga nidra will help you to reduce their emotion, to strengthen their mental ability. So asana, again, remove the first thing, the rajas, overactivity of mind, or overactivity of thinking. At the same time, the more dullness also. Because 61 means it's a retirement stage. So we think that we don't have any now work to do. What for we are. So that kind of thing also will not come in mind. You learn living happily. You will see the life in a different form. So that is
Okay,
how
thank
the
you.
overall benefit it will give it to the madam if she really want to take yoga as a further process for her life. So there is no age to learn. As long as you are breathing, you can do yoga. Right? So,
Okay, thanks, Amma. I am also student of Balamurali, sir. I'm in
okay.
touch with that and came to know you. Very nice.
Thank you. Thank you. So thank you all. So we will conclude our today's diabetes session and hope to see you all of you again for TTC. So we just further, we'll move on to asthma session. Vijay ma'am, are you there?
Yeah.
Yes. Thank you.
Can you make me co-host? Okay,
Yes.
I'm able to share. Okay.
All right.
Pull myself 1 second. Hari Om all. All right. So today, let me introduce myself. My name is Viji. I'm basically an IT professional. In the course of my life, I think I encountered a lot of health issues. And in allopathy, I could not find complete solution, in the sense that a lot of things I was told that I need to manage them. I cannot be cured. But I wanted to really, I could not accept that. So I looked for alternative ways of healing, and I found yoga. And it has really helped me to come out of some of my health issues. Also, like asthma is one of my conditions which I suffered. I used to be on inhalers. So, and I think right now I'm not on inhalers anymore. And I've also helped my family members to reduce, using inhalers. I also had like an autoimmune disease for which I was taking like medication for 10 plus years. And then, like in allopathy, again, they said all autoimmune disease, there's no cure. Right now, for the last 11 years, I haven't been taking my thyroid medications, which is caused by an autoimmune disease. And I keep checking my levels, it's perfectly fine. So after, experiencing the benefits of the yoga therapy, I wanted to learn how exactly it works scientifically so that I can take it to the world. And I've done MSc yoga, and also currently I'm doing PhD yoga. I've done lots of courses apart from these degrees in yoga and yoga therapy. And I want to share my knowledge to the people who are willing to take charge of their health, not through holistic healing. I mean, you can always get remedy from allopathy very quickly, but then long term, without any side effects, I think the people who are in this group are looking for such solutions. So yoga is the best place to do all of that. Okay. And I've also done my MSc yoga thesis on asthma for adolescent boys, because my son was also struggling with asthma for many years. So now let's dive into the topic of yoga therapy for asthma. I'm going to share my screen here. Okay. Is everyone able to see my screen? Yes?
Yes, madam.
Yes, ma'am. But you may go to the presentation mode.
Listen, okay. I think I have to go to the presentation mode and then come back here. Otherwise, I don't have access to from the beginning. Okay. Let me share now. Let me pin myself so you can see. Now share. Okay. What's the shortcut? Okay, from the beginning. Okay, all right. Is it in slide mode now? Okay. Yes?
This is right, ma'am. This is right.
Okay, all right. So what can we do through yoga therapy for asthma? Before getting into the yoga therapy part, I want to talk a little bit about asthma, so we all understand what is asthma, right? We might have heard, okay, asthma, somebody suffering from asthma, but we don't know exactly what it is. So asthma is a disease of the lungs, right? So our lungs are part of the respiratory system. So on this slide, you see the picture of the lungs. So you have like two lobes of the lungs. Actually, our respiratory system starts from nose. We all know we breathe in through the nose. If the nose is blocked, obviously, if there is any obstruction, we breathe through the mouth, right? So after we inhale, it enters through our throat, right? It enters into this pink part, which is called as trachea, okay? And then it branches into two branches, so which actually goes into the two sides of the lungs, left lobe and the right lobe, okay? And then inside here, you see so many branches, okay, which are bronchioles, okay, the small branches of the tubes. So the air is actually passing from the nose through all the structure, and ultimately, if you see these small bubbles, they are nothing but air sacs, okay, where the oxygen and carbon dioxide exchange happens. We all know that we inhale oxygen and then exhale carbon dioxide and other waste gases. So that is the main function of our respiratory system, and lungs plays the major role. So what happens in asthma to these lungs, right? So if you look at the picture here on the left hand side, that is the picture of a healthy airway. On the right hand side, that is the airway of the lungs for people who are suffering with asthma. So what exactly is the difference? If you see on the left hand side, it's wide open. On the right hand side, the pink part, right? That is actually inflammation. Okay, why inflammation happens? We'll talk about it shortly. Okay, so the airways basically become narrow, and there is also a lot of mucus which are further blocking the airway. On top of that, if you look at this pink structure here, right, the pink kind of rubber bands on the left-hand side, they are wide open, whereas on the right-hand side here, it is constricted. That is exactly what happens during an asthma attack. The smooth muscles, right, they go into spasms. So that is why people who are struggling with asthma actually have these symptoms, because whenever you're not able to take in oxygen, I think the body has the natural mechanism of coughing to push the things outside so that the airways can clear and more oxygen can come in. Okay, so these are some of the symptoms of people suffering with asthma. Coughing, wheezing is like the whistling sound, because already the airways are inflamed, okay? The allergens from the air can actually enter your respiratory system. And then what happens? The mucus will get generated, and whenever immune system fights, it is going to cause inflammation, okay? What is the the role of the immune system? It needs to get rid of the anything that's foreign that comes into your body, being it a virus or an allergen or anything. In that fight, the side effect is inflammations. The walls. If a mosquito bites you, right, and then immediately you get a bump. In a similar way, the same thing happens inside the airways in your lungs. Okay, so the inflammation is basically the swelling of the airways. So when something like, this is small, and then inside, if it swells, then the pathway is going to get narrowed down. On top of that, right, whenever you're exposed to an allergen, the body's natural mechanism is to produce histamines, like saliva, like a mucus kind of a thing, right, so that it can push it outside. Because when something has entered into your lungs, how do we push it out? So there are hair-like cells inside, right, and they keep moving, and along with the mucus you can wash it off. It's just like how you pour water and wash the outdoors. Just like that, we have the mechanism. So our body, the immune system, actually produces histamines, which actually helps. So that's why in the mucus you can actually, it captures the allergen that has entered, and then you can spit it out and you can get relief. Okay, so the coughing is one of the symptoms. Wheezing is the sound that is made when you're not able to breathe in or breathe out. I think you'd have heard that. It is like a people when they struggle, right? Actually, you'll see like this part going inside if they are really struggling. Okay, that is known as wheezing. And then because you're not able to get, because the airways is swollen, on top of that there is mucus, on top of that the muscle is also going into spasm. All this is causing what? You're not getting enough oxygen. So how are you going to feel it? You're going to feel shortness of breath. And then because you're overworking this area, you're also going to feel chest tightness. People who have experienced asthma will know that. Okay, so let me talk about the asthma statistics. How many people are really suffering with asthma. Okay. There are about 34 million, 3 crore people are struggling in India alone. Okay. And it affects almost like 13% of the world's population, and 42% of the global deaths occur in India because, like, India, we all know it's like there are a lot of people under the poverty lines. They don't have the right access, and they don't have access to, like, inhalers, and like, because they are expensive. And then it needs to be controlled through, and they probably are living in a very polluted area. Where will they go? So, lot of burden by asthma in India. Okay. And if we teach like yoga therapy, strengthening the lungs and how to handle the allergens, all that they can easily manage asthma. Okay. I'm not saying they need to be, people who are suffering from asthma need to get rid of taking the allopathy medications. It will be a transition. Okay. So usually we don't recommend. So whenever we talk about yoga therapy, we are not asking anybody to stop the medications, because we don't want to struggle with breathlessness or chest tightness, because that is not going to motivate people to pursue asthma further. Okay, so initially both modalities will be, I mean, you will continue to take the medications and learn yoga therapy, and once the symptoms reduce and the wheezing attacks reduce, then we can transition instead of taking inhalers on a regular basis. Again, it depends whether your asthma is mild, moderate, or severe. People with mild probably don't take the inhalers on a regular basis. People with moderate or severe asthma, they end up using, even if they're not using the rescue inhalers, which is to open up the airways right away at the time of attack, the steroid inhalers, I think it is to control, right? That is being given to children on a regular basis. Okay, so all that can be brought down. Okay, so what is the definition of asthma by World Health Organization? Asthma is characterized as recurrent attacks of breathlessness, wheezing, and varies in severity, just like how I just said, mild, moderate, and severe. It is recurrent because if somebody is allergic to dust, right, and you don't know when you're going to get exposed to the dust, you might be happy, and then you go to some place or go to a restaurant or go to somebody's house, and if they haven't, like, if they have some dust in their house, and if you encounter immediately within a matter of seconds, one could go into an attack, because the nervous system of the asthmatics is already very sensitive, because somebody is attacking, it's fighting, the fight between the immune system, it keeps going on a regular basis. So the nervous system is too sensitive. The moment you get exposed to these allergens, it's going to go into the spasm that I talked about, the smooth pink or the red muscles around the airways. They are going to go into spasm. So I think people with asthma, they usually don't step out. People with moderate to severe asthma, they don't step out without taking the inhalers in hand, because they're also like mentally they become weak, because they don't know. Breathlessness is not something that you enjoy, right? If I ask you to hold your breath for 30 seconds, would you really enjoy it? No. As soon as you can take breathe in, or like when we do kumbhaka, I think some of you are yoga professionals or you've done yoga. When we do kumbhaka, is it really comfortable? Not really, right? So but that is the state of asthmatics on a regular basis. And imagine how it is going to affect their sight, about their mind. They are going to have a fear of having asthma attacks in future. When they are going to step outside, they are going to be worried. Am I going to get an attack? Am I going to get exposed to something? Sometimes it could be like the pollen in the air, right? Like during the spring season, when a lot of flowers bloom, you don't know, right? We are not going to sit and watch, okay, which flower is from which tree is going to bloom. We don't know. If you step out in that particular season, you will probably end up having an asthma attack. Okay, so they feel suffocated and they end up using a lot of chest and clavicular muscles. Why? Because we are trying to breathe out forcefully, and automatically what happens is the shoulder curves. People with a moderate to like severe asthma, you can actually see, because they continuously breathe like that, this becomes permanent for them. The rounded shoulders or the hunchback, right? If you look at the picture here, it becomes like a hunchback. So what happens? See, already when the pathway is straight, you're struggling, and further down, the pathway is like, it shifted, altered because of the structure change, right? It is again going to obstruct more prana coming into the body. See, generally we say we inhale oxygen, but we also take in prana when we breathe, right? So when the pranic balance is, what is the definition of disease according to yogic philosophy, right? When there is an imbalance in the prana, it leads to disease. In Ayurveda, I think we have like a different definition. In naturopathy, we say accumulation of toxins lead to disease, right? And the 5 elements, Pancha Bhutas, we talk about, if there is an imbalance, it leads to disease. The various definitions, okay? And in yoga specifically, when the pranic balance, for example, I think we just talked about diabetes. When the prana, the pancreas is disturbed or obstructed, or it is not in full strength, then pancreas is not going to work efficiently. Same way, the prana to the lungs is not proper, right? It is not in full strength. Then people are going to develop disease of the lungs. Okay? So, what we are going to aim in yoga therapy is how to restore all this. Okay? And also, there are some structural changes because of the way they try to breathe. They end up using this muscles. So, this hunchback, how we can correct them, right? How we can correct the posture, how we can strengthen the muscles. Because the intercostal muscles, right, the rib cage, it needs to expand completely, and then the diaphragm needs to move down. Only then you'll do abdominal breathing. Half of the time, we don't breathe. We don't do abdominal breathing, mainly because of stress. I want you all take this as a homework and observe how you're breathing when you're stressed, when you're happy and sad, or when you're tensed, right? Like anxious. I want you to observe and observe a baby who's sleeping. How observe the falling, right? The rising and falling of the abdominal muscles, and see if you're actually breathing like that. See, that is the right way of breathing. And a lot of disease is because we are not breathing right. So we can certainly correct those through yoga therapy, specifically through pranayama. Okay. Now going back to, let's move on to causes of asthma. So fundamental causes are not known. It's supposed to be like a interaction between genetic predisposition and environmental exposure. Okay, but there are a lot of triggers that can actually do. Most of us could carry the genetic genes which can actually cause disease. But whether you're going to develop the disease, it's going to depend upon how you interact with the world, how you carry yourself, right? Because a lot of that is based on that. Just because I've inherited this gene, my parents had asthma, does not mean like, I'm going to have, okay? It all depends on the how we interact with our environment, okay, our lifestyle, our thoughts. You probably have like a perfect lifestyle, meaning you do exercise, you eat right healthy food, but your thoughts are not clean. That can also lead to disease. I think more and more research are being like published these days, like basically like causing like or like identifying the mental, the emotional pain, like the mental factors, your thinking, ways of thinking, your thinking patterns, how it leads to disease. But how do we know about how we think, right? In yoga therapy, we'll give you a tool for that. Okay, these are some of the allergens which I already mentioned, like pollens. If you have pets at home, or like when you go in outside into the world, how much fumes you can actually wipe off the black dust from your face, isn't it? So much. Okay, so those are all external pollutants, right, or triggers which can actually cause asthma, or make a person with an asthma go into an attack with within like seconds. For some people, even the cooking smell, hormonal changes also can cause some of the drugs. For some people, like food, right? Like, we all say nuts are very good, but and milk is very good for children. But for some people, if they are allergic to it, right, it can actually cause an attack. Okay. And sometimes when you catch a cold also, you can get an attack. Apart from that, I think that this is a big list. Okay. And I just want to make, for some people, exercise can also cause asthma. Okay. So your emotions can also cause depression, etc. Okay. Being sad or overly anxious, they can all aggravate the condition. Okay. Now, treatment and allotherapy, I think it's like, like I said, the immune system produces histamines. So what we try to do, we'll give medications to control the secretion. So everything stays inside. So we accumulate everything inside the body, but in the long term, it is not good, right? So inhalers to open up the airways, right? So there are two inhalers usually given to the asthma people. One is rescue inhaler, which opens up the airways immediately so that you can get in more oxygen. And the second one is like the steroid, which will actually keep the lungs like in a state of calm, basically. But the equivalent of that, we are going to learn in yoga therapy, okay? How to calm down this nervous system, how to open up the airways. Like, I know that you cannot do like as asanas at the time of probably like, if you're really struggling to breathe, you'll be extremely tired. Probably at that point, probably you can do, but there are other techniques, easy techniques like Jalaneti, because if your allergic asthma got triggered because you inhaled dust, right? Dust mite specifically, you can do Jalaneti, which is like a matter of like couple of minutes and wash off that allergen so that you can calm down your system's reaction, right? So there are some simple things, or you can do like simple pranayama. Okay, so that you don't have to make this particular exposure to the allergen into a full-blown asthma attack, because a full-blown asthma attacks takes like a week to 2 weeks to recover. But if you take some precautionary measures using the yoga therapy tools that we will be teaching, right, probably you can get rid of the symptoms on the same day or 1 or 2 days, right? Instead of like, staying at home for 2 weeks because you're too tired to go out. Because when there is less oxygen, you really don't have a lot of energy to do things, right? Children probably they can go out and play with the other kids. How sad it is, right? Even like, you want to go for shopping and you don't have the energy, or you want to go do some your favorite activity, you can't do any of that because you are going to feel very weak. Okay. So, using the yogic tools that we teach, you can actually reduce the symptoms from 2 weeks to 2 days. And eventually, like, if you cultivate the awareness, you can actually avert within few hours. Okay. So what are some of the yoga therapy tools that we are going to be teaching? Is cleansing techniques, and then we'll be teaching asana, Surya Namaskar, pranayama, relaxation techniques, meditation. Okay, these are some of the techniques. And what it will develop. See, why there are so many diseases these days, right? 1 second. Sorry. Okay, I was just trying to ask my maid to sleep later because it's creating some noise. Okay, so these are some of the techniques that we will be teaching for asthma therapy, yoga therapy for asthma. So cleansing techniques, I already mentioned, if a dust enters or pollen enters through your nose, right? And if your immune system is going to be fighting, right? It's going to be creating, producing histamine and then fighting, because as long as that is going to be inside your nasal cavities, you can easily wash it off by doing Jalaneti. Okay. And we will also be teaching like Laghu Shanka Prakshalana, which actually like cleanses the entire alimentary canal. Okay. So the salt is actually very beneficial for asthmatics, and some of, the water that we use, we'll actually mix it up with water and do it. And we'll go into the benefits of all these techniques in detail in the course, okay? Because I'm just given like 45 minutes just to give like a glimpse of what we are going to teach, okay? Asanas. So how asthma is beneficial for like asthmatics especially. In one of the pictures, I showed like the hunchback, the curved shoulder, right? So we need to open up the shoulder, right? That certainly can be done using asanas. So we will teach you specific asanas that will open up your shoulders, open up your rib cage, strengthen the diaphragm, right? Also, your back strength is very, very important, not just for asthma, for any disease, okay? Because the signals from the brain are being sent to all the organs through your spine, right? The spinal cord. And if there is any blockage, if there is any obstruction, then signal is going to be disrupted. So the back strengthening asana will also be included for asthmatics. Surya Namaskar. Surya Namaskar itself is a complete, like a sadhana. It's like a full therapy. It has asanas, pranayamas. We'll also be doing Surya Namaskar with mantras, okay? And with complete awareness. Why complete awareness, or why awareness is very important? Because when you are aware of a particular organ, right, where the mind goes, prana goes. So if you want to heal a particular part of your body, a particular organ of your body, you need that awareness, right? So that you can push more prana. As I mentioned earlier, when there is an imbalance in the prana, it leads to disease. By consciously taking our attention to that organ, you're basically diverting the prana to that diseased organ, diseased tissue, diseased cell, so that it can rejuvenate. I think somebody asked one of the questions, is it really possible, right? Everything is possible if you believe that you are going to get cured through yoga therapy and diligently do that. It's not like an easy, because some of you, I think you mentioned people are really old. Yes. So can you really get rid of your thought patterns in a short time? No. The recovery also will take a little bit longer. Okay. See, that's the key. The more like, you're used to something, it automatically comes. Whatever is stored in your subconscious, you just do it like unconsciously, like, you just do like, sometimes I forget my password. And when I sit in front of the computer, right, my fingers will go and automatically type the password. But if I sit down and think somewhere, I can't remember. So a lot of habits we have created, okay, including negative patterns of thoughts. And how do you become aware of that? You can become aware of that through the meditation practices that we will be teaching you. Okay, Antarbhavana. So these are like some of the techniques that we'll be teaching. I think I'm just giving you the glimpse. And one important thing is, like if you go to Google, right, like you can find, yes, this asana is good for this disease, this mudra is good for that, this pranayama is good for that. Yes, okay. What if a person has like, asthma and high BP? For asthma, probably the Google says, yes, do Surya Bedana Pranayama. Okay. It'll teach about all things that will actually increase the fire element in your body. But for a person with high BP, what it's going to do? It's going to worsen the high BP, right? So you need to be aware of the contraindications, not just the benefits. You need to be aware of the contraindications. So that's why you need to understand each and every asana, pranayama, mudra that we are teaching. Just like how when the doctor, when you go to an allopathy doctor, he asks about all the conditions you have, and then he will prescribe certain medications, right? Like stroke medications. If you're really old, they probably won't give you certain medications. Or if you already have an underlying condition, they won't do that. Same way in asana, pranayama, mudras, all of that, one needs to be aware of the contraindications, because you'll be curing your asthma, but then you'll be worsening your high BP. Okay, so you need to understand thoroughly, okay, what to do and what not to do. That is why, like, just don't go to Google and then start doing it. Or if a person has ulcer and if he does like Surya Veda Pranayama, I think it's going to get worse. Okay. So that is why we would like to recommend not just our school of yoga, any school, like any experienced teacher, go to them, learn thoroughly, understand, and then start doing it, because your history is also important, right? Okay, I'll just attend this webinar and then start doing this. No, that's not the right way. Okay, be in touch with a yoga teacher who is an expert in the subject and then start your practice. Okay. Asanas, I already mentioned, coming back, it corrects the posture, strengthens the back, strengthens the intercostal muscles, opens up the chest, removes blocks in the pranic flow. And we will also teach you, okay, I just used like a generic term prana, right? Just like in our body, right, we have different system governing the different functions of the body. Respiratory system takes care of our breathing, the gas exchange. Your digestive system basically digests the food, absorbs the nutrients, right? So each system has its own function. The same way, the prana also is, we have classified the major pranas, like these are the 5 major pranas in different colors, which governs different functions. So we will go into details about each of these pranas, which prana is governing, or if you have imbalance in which prana, it is going to cause heart disease or asthma, and how you can restore that pranic balance. So all that will be covered in detail. So what are some of the factors affecting this prana, right? I talked about, okay, there is a pranic imbalance. How do we end up with this pranic imbalance? Mainly our lifestyle, exercise, sleep, food, work, sex, your mind faculties, your emotions, thoughts. Like I said, you could be eating, sleeping for 8 hours. You could be eating sattvic food, right? But if your thoughts are going out of control, if you're holding a lot of negative patterns in your thoughts, that again will lead to disease. Okay. So how we are going to restore this pranic balance? As I mentioned, we can correct it through asanas. See, asanas, if a pipe is bent, if you're watering a plant, right? If a pipe is bent, the water is not going to flow completely. So through asanas, we are actually going to correct the structure. And then through pranayama, we are going to restore the pranic flow. We also have a separate course like for mudras, because people who are older, who cannot do the asanas, right? Because it needs a lot of physical strength. By the time you are 60 or 70, if you haven't had like a very active lifestyle, probably you will not be interested in doing asanas. We also have like a shortcut, like mudra course, where you can actually restore the pranic flow by doing simple hand gestures. Okay. So through pranayama, we are going to restore the pranic balance. Okay. And yoga nidra. So yoga nidra, I think already Pallavi also mentioned. Yoga nidra, like we think that when we go to sleep, we are actually relaxing. It's not. Lot of times you wake up, so unrested, with disturbed your mind. When you wake up, you would have been in bed for 8 to 9 hours or 7 to 8 hours. I think the time keeps reducing nowadays because we are living in a digital world, right? Sleep is not actually a relaxation. In yoga nidra, we'll teach you how to consciously relax, how to get rid of the physical, mental, and emotional tensions, which is the root cause of many, many diseases. All the psychosomatic diseases are originating in the body, right? You're not completely relaxed. So we'll teach you this beautiful technique, Yoga Nidra, how to relax yourself, because when you are in a state of calmness, a state of peace, right? When you are totally relaxed, that is when you can actually recognize your true nature. Why there is so much disease in the world? Because we are moving further away from ourselves, right? with each generation, because we are so much like the sensory stimulation is so much, we are forgetting who we really are. We are not relaxing. So once you realize your true nature, you can actually connect with the divine, right? And then the solution comes to you. You know what is the right action that you need to do, which areas of life you need to focus to get rid of the suffering that you're going through, be it physical, mental, or emotional, whatever it is. Okay? Our true nature is Sat Chit Anandam. We are going further away from ourselves, and more and more and more diseases. I think Pallavi beautifully gave so much statistics about a lot of disease. Why more? We have so much advanced technologies, but we are like, going like into so much. The burden of the healthcare is increasing. It's in trillions, right? So this Yoga Nidra will deeply relax you, and then you can use that relaxation to develop memory, to increase knowledge, creativity, or whatever you can achieve. Okay, so these are the various tools that we will be covering in a very depth manner when you join the course. So who should join the course? See, we call the course like teachers training course. So some of you might think, yeah, I'm already 60, I'm already have diabetes. I really don't want to become like a teacher. Yes, if you want to heal yourself, it's also perfect for you. Okay, and there's no prerequisite. Okay, just understand, like when you listen, because knowledge actually makes you take the right action. You will gain a lot of knowledge from this course. So if you want to take this knowledge and help other people, it's perfect. Or if you just want to heal yourself or heal your family members who are struggling with some of the conditions, right? You can do this course because it's like a home remedy, right? Which you can actually do it at home so that you don't have to run to the doctor's office for every small occurrence of an attack. You can manage to control not just asthma, other diseases that we are covering in TTC 1 and 2 courses. Okay, all right. So now I would like to open. With that, I conclude my presentation. And if you have any questions, I think I'll take 3 questions.
Madam, I have a question regarding the
Yeah.
food for the asthma patients.
Yes. Okay. We will also be covering that part in detail. Sorry, I forgot to mention what diet should be taken and how fasting is beneficial, right? I'll just give a little bit glimpse. So, the food, right? So we talked about 2 things. One is like there is going to be a lot of mucus, right, in the airways. And there are a lot of foods that will actually increase the production of the mucus. So you should avoid that. And most of the asthma that we are seeing in today's world is because of increase of kapha, the water element in our body. So such foods also should be avoided. And another thing, foods that will increase the air element in your body should also be avoided, especially at the time of attack. See, I'm not saying like you have to be on this diet throughout 365 days a year because it will become frustrating, right? Yeah, so when having an attack, right? So why the air element? How the lungs work, when the lungs and the, like our chest expands, the diaphragm actually moves down, giving more space for the lungs to expand. If you eat a lot of, I don't know, chana or like, rajma or like, cabbage, things like that. We all know like potatoes, we all know that you're going to be bloated up, right? So what will happen if your stomach is already bloated up? The diaphragm won't be able to move down. Only if the diaphragm moves down, you can do abdominal breathing. So these are the things, precautions that you need to take care in terms of diet. Okay?
Thank you, madam.
Yeah. Any other question? I think even if you don't have a disease, by doing these practices, actually, you'll be connected with yourself. You will understand more about your true self. For those who are actually pursuing spiritual journey, right? All these practices, yes, it is going to restore the pranic balance. Once the pranic balance is like, you have the pranic balance, then like, your mind opens up. You can actually make very good advances on your spiritual path, right? You'll know what is important in life, what is not important in life. Talking on the phone for several hours, is it really going to bring any, anything, any value to you? No. So a lot of things, we just do it. We immerse ourselves in the sensory usage, right? Like eating, listening, watching, gossiping, all that, because we are so much into that. And because, see, sometimes it is also because we have some emotional pain. We don't want to deal with that. We don't have the strength because it's going to make you very uncomfortable. When you practice all this yoga nidra, antar mauna, you can actually bring up whatever is stored in your subconscious. Some of those could be from your childhood, which will be the root cause of the problems right now you're facing, right? You don't know. So all that can be released through antar mauna. The negative patterns of the mind can be released, and you can have a very fulfilling life. Okay. Yes, sir. Please go ahead.
Ma'am, another question I have.
Yeah.
The slide that the slide that you are showing about pranas, putting in different colors. The last one, I think, if I remember, is Vyana or something. There is
Yes.
which is depicted in white color.
Yeah.
Is it present all over the body, or
Yes,
how?
Dhyana pervades the entire body.
Okay.
Think of it as like the brain which governs all the functions, right? Whenever other prana is depleted, Vyana comes into place and then helps to bring the balance. Yes, Vyana pervades the entire body.
Oh, thank you.
Yeah. Yes, sir. Rao, sir.
Namaste, Amma. What we, I think I just looked at the course. It is covering various elements from 8 to 12:30. Are the recorded sessions are made available to the students?
Yes. Yes, sir.
Because for any unforeseen thing, if you have to
Yes, if
miss,
you are not able to attend, or if you have like a marriage or function, or if you are sick, if you are not able to attend, the recorded sessions will be given, sir. And I think there is a time limit because I think we have so many classes happening. I think it probably will be available maybe like 4 to 6 weeks or something like that. I think Balamurali sir knows better. You can get in touch with him. Yeah. If you are unable, if you are traveling, unable to attend, because it is a long commitment, right? Like a 3 to 4 months commitment. Yes, recorded videos will be provided for you. And we will also give materials of what we are teaching, everything. Sir, can you, how long are the videos available, sir?
Namaste, Balamurali sir. Namaste.
So this the recordings will be there for 1 or 2 weeks, but the 100%, all the attendance 100% is compulsory for all the courses because these are all therapy courses. Only one absence is allowed, sir. One class you can absent because that unforeseen situation will happen to anyone. Any emergency will come. But second time, if we are absent, then ashram will not allow us to write the exam that time. If third absence is there, then we need to redo the course again. Because Swamiji is very strict. This is therapy. We are playing with others' lives. So we need to focus and learn. This is a compulsory thing for all the admissions.
Yeah, I understand, Balamurali sir. This is for self-learning, as you know, because I've been with you for more than 1 year, I think. Of course, I already suggested for the people to payment basis, referring to those recorded sessions. You may consider for these courses also, because I knew when to refer, because after a journey for some time, we need refresher. So sometimes you have to go back.
Yeah.
This rules I'm telling is only for the people who need certificate, because there are few people who come just for knowledge sake. Then there is no issue. You can come and learn. So there's two types we have. When we really need a TTC certificate, then 100% attendance is compulsory.
That I understand.
Yeah, those who are really serious about teaching, we'll actually give you practice how to teach, right? You'll be teaching for your classmates so that we will also make the correction, because how to teach, all that, sometimes we just think, yeah, you would have learned it and then you'll go and tell. But some of the important aspects, like, we'll forget to mention. So we will also, those who want to teach others, those who want to heal people, right? How to teach, that practice also will be given. After every disease, like we'll have like a small viva, and then where you'll have that, that is why this course is called as teachers training course. How you can actually, how one should teach, what are the important aspects, so that the corrections can be made, right, by the senior teachers. So you take the right knowledge in the right way to others, right? Okay. All right. Yes, ma'am. Please go ahead. Ask your questions, Swarda.
Namaste, ma'am.
Yeah.
Am I audible?
Yes, you're audible.
Yeah. So is this course also available offline in the ashram, like for a lesser duration or something?
I think in the ashram only one-on-one classes are available. Like if you want, like, I think previously this used to be offline. I think after Corona, I think we completely went online. But if you want to learn, if you, I mean, for a yoga, if it is for personal, right, you can always make appointment for a one-to-one session. But we
Okay.
don't, right now, to my knowledge, we don't offer offline courses there. Balamuri sir, I'm correct, right? We don't offer offline courses anymore.
Yes, you are right, ma'am. This
Okay.
TTC is only available online. Only one-to-one yoga therapy for the treatment is available. Swamiji is there. You can directly take
Yeah.
treatment.
From
But
Swami.
that's not therapy. One-to-one therapy is available.
Yeah. If somebody is
Okay.
struggling
Actually,
and want
I'm
to come
yeah.
attend, learn from Swamiji or come to the ashram and learn, then you can come to the ashram.
Okay. So which are the courses which we can come and learn there?
Now, actually, course to come and learn in ashram, ma'am. What advantage is there if you do any course in our TDC course? Swamiji is there in all the group. So you can always talk to Swamiji, talk to all senior teachers, everyone. You can take their guidance when you start practicing. Once you learn, when you start practicing, you may have a lot of doubts. So that support from ashram is there. If you want to meet, you can come to ashram anytime to meet Swamiji. You can clarify those things and all. But there is no offline course as of now available at ashram. Because post-corona, there are very less people available, so we are unable to continue it. Only morning, there is a regular yoga session happen, 6 to 7, 7 to 8. That's the only course happening offline at ashram.
Okay. Okay. Because I'm a doctor, so I actually wanted to learn other Indian systems so that a holistic health approach can be given to patients, like rather than just prescribing allopathy. So that's why I was looking forward towards this course.
See, whatever we are teaching in offline only, we are teaching online also. Only thing is we are all not in the same room. We are all at
Yeah.
at the convenience of our own home. So yeah.
Right. Okay. Thank you so much.
Apologies for my intervention, Swarda madam, because I came across this institute near back and the journey is very wonderful. I recommend you to, if possible, to attend the online course, then start the interactions and with Swamiji and other things. And you will do a human service to your patients through that route.
Right.
Offline, we
Sure.
often meet for celebrations. Like I think tomorrow, I think there is going to be a celebration. There's a lot of like yagna happening in the ashram. Like whenever there is like a festival, I think we get together offline at the ashram. So yeah, like we'll sing some bhajan and do stuff, yagna and some food. So offline, we are not meeting for courses, but like more like satsang kind of an event. We do meet, so that we can meet
Okay.
Swamiji also in person, other teachers and other people who have done the course in person. Yes.
Okay. Thank you so much. What is the course fees like? In the photo, there was no mention of the fees.
I think Balamurli sir, are you there? It's around 10K.
Yeah. The course fee is 14,000 rupees per TDC course, ma'am. TDC 1 or 2 each is 14,000 rupees.
Okay.
Any other question?
Okay. No, thank you so much.
Yeah. I'm really glad that you want to include this holistic approach in your, profession. I'm really glad, because I think that's the dream actually in future, because allopathy alone is not sufficient, is what like I think more and more research is telling, or the increase in disease is telling. So both need to work together, to give relief to the people. So I'm really happy that you're considering attending the course.
Thank you so much.
Okay, if there are no other questions, I think we can close the session. So please reach out to Bala Murali sir. If you have any questions, I think, yeah, for any kind of questions, I think he's the one person to go to all. So thank you so
you.
much. Hari Om.
Thank you. Hari Om. Excellent sessions. Both are very good, actually. Thank you.
Thank you.
Hari Om, Vijay ma'am. Hari Om.
Hari Om.
So
Hari
nice.
Om,
Both the
ma'am. Hari Om.
sessions,
You're
both the
Thank you so
sessions were
much. Hari
great.
Om.
hypnotizing people to join the course with your voice and with the